Hey everyone, welcome back to Midday Kentucky. Well, I've spoken with Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services regarding laparoscopic and robotic surgery. Now today we'll take a look at part 2 of my trip and continue the discussion. But take a look and don't judge me for what I'm wearing. Take a look. Dr. Smith, people are still having laparoscopic surgery. Why do you encourage people to have robotic surgery versus laparoscopic, even though you still perform that?
Well, there's certain procedures that are very basic that laparoscopic surgery is sufficient, and the robotic technology may not offer as many benefits. However, in 2017, there's very few laparoscopic procedures that I don't believe can be improved by doing them robotically. For example, hernia surgery. It's the #1 trained procedure in the United States right now. It's the fastest growing procedure in the United States right now, done in a minimally invasive way because robotics has taken over that. The company that makes the robot, they've trained more surgeons for hernia work in robotics than they've ever trained in other specialties over the last 6 to 12 months. And so that's something that a lot of people thought was a very basic procedure, but we're finding we can do it much better. Unfortunately, in 2017, there's still lots of patients that get an inguinal hernia or a ventral hernia done open, still to this day, because of the limitation of maybe the surgeons not being trained laparoscopically to even then make that second step and go robotically. But robotic surgery has even brought awareness to those surgeons who were doing open surgery to now realize, hey, I can learn robotics and I can add this to my practice and offer something much better to the patient.
As I'm talking to you now and listening to you, is there less downtime when you have robotic surgery as opposed to the other surgery?
Well, compared to open surgery, absolutely, there's a no-brainer. I mean, you're talking restrictions of lasting a week or two compared to 10 to 12 weeks. Laparoscopic surgery, that margin is much more narrow, but we do, in certain procedures, see decreased pain, decreased length of stay. For example, when patients come in to have colon resections done by me for, say, colon cancer, these patients are going home in 1 to 2 days.
Right.
If they had that done open, they would be in the hospital probably 5 to 6 days. And even laparoscopically, even though that length of stay was less, it typically was more than when we do it robotically.
Dr. Smith, talk to me about what you're going to be showing us now.
So there's obviously lots of advantages of robotic surgery, but a few things that we're going to do is first, with the robotic instruments, I'm going to show you what my mobility would be limited to if I were doing this procedure laparoscopically and the motion involved. And you'll see as I'm moving the instrument can go into the patient, back out of the patient, it can move side to side, but it's really in one straight axis. It's as if I'm wearing cast on my wrist, and that is the only motion that I have. Now, if you start seeing the motion that I have with the instrumentation, it adds in what the robot offers. And so the audience isn't able to see the optics just as well, but I'm seeing this surgery or this procedure done in 3 dimensions, but now I have complete wristed motion inside the patient. Through 2 small incisions, I can work in multiple angles and handle tissue just as if I was using my own hands, but not having to open up the patient to do so.
Talk to me a little bit about when you're doing robotic surgery, how a surgeon has such control.
Well, laparoscopic surgery or even open surgery, we have assistants in the room that are having to help us with the procedure. Unfortunately, God only gave us 2 hands, and so we're limited with that. Robotically, I control 4 instruments inside the patient. I control the camera as well as 3 arms, and there's no other technology that we have that can emulate that. So what you're seeing now, with just some basic movements to show an example, is essentially I can retract tissue or assist myself and lock that arm in place and switch to the other arms. All the camera movement that you see right now is controlled 100% by me. I'm not dependent upon a tech in field or someone else who's not a surgeon to handle tissue, move tissue, or improve or control my visualization. I have control of nearly everything inside of the patient, and 100% of the surgery is always done by the robotic surgeon.
Dr. Smith, why are you the only training facility in the state of Kentucky for general and bariatric robotic surgery?
Well, I've done more volume in general and bariatric robotic surgery than anyone else in the state of Kentucky. Our team is the only teaching site in the state of Kentucky. We've trained surgeons from all over the United States. We've trained surgeons even from within our state too. Our outcomes have been superior. We've done nearly 1,200 cases on the robot, which leads us to be the one site that Intuitive chooses for us to train these surgeons that want to adopt robotics into their practice.
Dr. Eric Smith, thank you once again. If you want to find out more information, head over to our website at wtvq.com/Midday Kentucky, or you can see all the information on screen right now for Dr. Eric Smith, and they have some incredible videos on there as well to get great information. We'll be right back after this short break.